Medical Dilemma.
Welcome back to Medical Dilemma. Again, we would like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, to start our third segment, I'd like to ask again Father Jerry first about disclosing the condition of a patient to the patient himself or herself.
Well, bioethically, there is what we call the principle of truthful communication and avoiding lying. No, no. Whenever there are things like that, and let's say there are doctors who would not disclose the condition of the patient, it may well be that the doctor is just buying time for a while. No, but in the end, they have to disclose to the patient or to the family, because we know for a fact that the truth belongs to the patient, because he's the one who is sick. Sooner or later, you have to disclose it. But you know, in the disclosure, there must be some sort of art in communication. Okay? It's not always na, you just, oh, di ba alam na may cancer ka? So, walang ka-arte-arte naman yun, no? Even in the disclosure, for example, of terminal illness, no? Sometimes there are doctors who are very good at that. They sometimes start with something small. Actually, the doctor is preparing him for something big. Start small, a little bit bigger, bigger. So, as he goes gradually towards something bigger, the patient is already prepared. And there is art in communication there. And remember that medicine is also an art.
Yes.
It's not just a science. No?
So doctors have to be also practicing empathy
That's
towards their patients.
All the time. Whenever a patient comes to him, in the first encounter, immediately empathy must be established together with trust.
Okay, so Dr. Noble, how do you reveal to your patient that?
Well, definitely,
he
I
has
agree
suffered a
with
stroke?
that. Now, of course, the end is, of course, revelation.
Right.
You have to reveal, disclose to the family. However, there are always exceptions.
Okay.
And maybe I may start with that. Number one, if the patient, we call them aphasic, meaning they have lost the power to communicate. No matter how you tell them, of course, there will be signs when you examine the patient, if the patient is capable of understanding or not.
Right.
It's futile to do that, to explain it to the patient,
Right.
because you will not get anywhere. But of course, we reveal to the relatives.
Right.
Okay. And the second, which is, again, there is no hard and fast rule regarding this, is if the patient is severely depressed. That's why I may need the help of a psychiatrist to go. Why? Because some go in really severe depression to the
Is it
point.
part of the syndrome?
It may be. It may be. Remember, depression. One of the postulates now for depression is chemical change, which may be induced by stroke as well. So, if you reveal to this patient, and the patient is somehow capable of posing harm to himself, then you may have done something bad already. So, eventually you will do it, but make sure that the patient is controlled well with regards to depression. There are certain, again, states wherein antidepressants already are part of treating the stroke, even if the patient doesn't suffer from stroke, they give already. Because somehow it gives them a optimism. It gives them a certain high, or I should say, good expectation from whatever disease entity they've had, for example, stroke. Now, with regards to our art of revealing, well, it goes, of course, what is important, and I may say this is something that we can exchange among Filipino doctors, separate tests will agree, is our ability to communicate with the patient and the family. Makikita mo naman kung talagang unang-una, makita mo na kaya nang itanggapin ng pasyente.
Right.
No? Kasi marami dyan talagang, wow, I have had patients na pag 5th day na, nanghihina na, wala akong stroke, wala, ano sinasabi.
Nasa stage of denial.
Well, it's part.
Oo.
Actually, in patient care, you will always remember the 5 stages of Elizabeth Kubler-Ross, no?
I know.
So remember,
Denial talaga.
the denial is the first, no?
And even to the point, ang problema dyan, if it is a growing thing in the
parang
family, no? Hindi ibig sabihin, lahat naniniwala, wala namang stroke yung
Oh,
pasyente.
that's right.
May ganyang pamilya
And then
niya.
they get another stroke.
Kaya nga, it's more important. So you have to apply certain strategies. Of course, as in Makati, it may not be hard because I can come in with a team, no? But
Right.
if you are solely practicing in the province,
Provinces.
then you may have to really seek the consult of another physician or neurologist to at least to back you up, no? Kasi mahirap talaga. It goes on. Tapos paunti-unti mong i-reveal talaga.
Right.
Kasi
Paunti-unti.
I mentioned while we were off air na talagang I've noticed, and we know this very well, masyadong caring tayo, masyadong emotional tayo as a race. No, madali maapektuhan tayo. And stroke is not in fact, others term it as brain attack. No? So, sudden. So, marinig po, God, nagkaganon ako. So, it poses a lot of challenge to yourself and to your family, especially if you're the breadwinner. So,
Yes.
maraming magugulo sa isipan mo. So, dapat, as they call in magandang terms sa Bisaya, hinay-hinay.
Hinay-hinay ra.
Yung talagang,
Hinay-hinay ra.
tapos at the same time, hindi mawala yung, in fact, kahit sabihin mo, yung wala, theoretically, of course, once a part of the brain has died, it has already died. It depends on the rest of the brain which takes over the function of the one that is affected. Pero, yung ano mo lang, yung regular, ano mo na sabi, gawin mo ito, nakakainganyo sa kanyang talagang babalik sa kanya. And you hear see a lot of these patients who suffered from a paralysis later on, they work, nagagamit nila yun. No? So, ang laking tulong ng, if you said about rehabilitative therapy, kailangan talagang emotional and spiritual support.
Yes, of course. As a matter of fact,
it really helps a lot.
good medicine is also giving something which, anything that is good,
Oh, yeah.
it always adds up to his better condition afterwards. Anything that is good, whether psychological or, praising him for being brave, etc. And anything that the person can feel good for the patient, give it.
Yun lang
It's going to
Dapat
help him a lot.
sensitive lang tayo minsan kasi may ibang mga pasyente naman napaka-sensitive. No?
In what
I
sense?
know, well, we cannot contest the fact there may be some of our colleagues or maybe sometimes we're guilty about it na mas tactless tayo, biglang magsasabi tayo ng information. Makikita mo naman sa mukha ng makikita mo, nag-iba yung progress, biglang bumagsak. No? So kaya nga talaga importante sa ganitong klase na tingnan mo regularly ang pasyente para makikita mo, especially kung nasa hospital yung pasyente.
You know, Perry, I know part of your team, yung mga psychiatrists, etc. What about a priest? Is that part of the
yes,
team too?
I called them once because in Makati Med they do
You have a very
count.
strong-
They have a very strong tinitingnan nila
pastoral
if
care.
they same
Pastoral
faith,
care.
no, sinabi ko,
Right.
pinapapunta ko talaga. And especially kung feeling ko malakas ang
Faith.
faith
Faith.
niya.
Yes.
Oo.
Yes.
Pero kasi yung iba pag nagdadating na Father, sorry, nagka-question na sila. Huwag muna. Hindi, may mga ganun talagang and even they feel that it is a punishment. It's guilt because they did something wrong. Ganun sila. So wait. Hindi. Kaya nga, in other words, talagang andudoon ka bilang hindi lang doktor, kung hindi parang ikaw sa Tia Deli niya, ikaw rin yung kanyang tiga-payo, dapat paringgan mo lahat ng aspect.
Perry, kung lawyer, siguro lalong ma-stress, ano?
Hindi naman.
Hindi rin.
Hindi naman. Marami
Pwede
akong
rin.
barkadang
Gawin yung
lawyer.
last will.
Okay naman.
Hindi. Doon sa may sakit.
Oo.
Gagawin niya ng last will niya. Joke
Going
only, ha?
to that part test, no? Kasi maraming mga nagkakastroke and they get younger nowadays.
Oh, yeah.
There's one aspect I forgot to mention. Sorry guys, the use of bawal na gamot, no? That causes our population to be younger, no? They are really prone to developing stroke also. Okay, so what am I driving at? No, yung kasi pag nangyari ito, hindi nila alam kung anong gagawin, no? So they call lawyers and everything. Ang problema, pag nalaman nga natin ito, ano ba ito? Sasabihin natin sa pamilya. May ganyan up to the very end. Tapos, saka lang dumating yung, I don't know, for some reason, na-delay yung result. Positive. I was thinking, ano kaya? What may have brought?
The HIV, you mean, or other
And I
infection?
didn't find out until And of course, diniretso ko yung parents, we cannot disclose this to the patient. Why? Because it may be later on when you go back to, because he's an expat Filipino.
Yeah.
So sinabi ko, but later on he has to know that
Right.
this caused it. Okay.
Doctor, what's your view on the use of supplements na not certified naman by the FDA?
FDA.
These that claim
Come on
na
You
nakakatulong
have to
daw
say
sa
not
dugo.
therapeutic
Oh, yes.
claim. I mean,
Ako naman,
it helps. Does it help?
I'm very open to it, especially kung wala namang masamang nagagawa. And somehow, if a supplement is told me, or I've read about it, and the patient and the relatives have tried it already, I read upon it. And of course, I try to see, this one, only testimonials will help, do help, because they are not subjected to scientific study. No, meaning yung kino-compare yung hindi nabigyan, ganyan, tapos titingnan, follow up and everything. But somehow, perhaps because starting pa lang yung company, tinitingnan lang nila kung saan nila na-observe kung effective ito. So, I feel, myself, of course, I do not prescribe it first line. No? Siyempre, darating man yun, halimbawa pag tinanong ako,
Yes.
and of course, I give them which is the more popular, and I think that has a promise. No? Oh. But of course, if the another physician suggests subjectively, of course, I would not be that stupid not to say, but sasabihin ko lang ang precautions, no? Kasi we know for a fact, lumabas yung ibang issue na some supplementals can cause bleeding and everything.
Yes.
And we're quite aware of this. Basta they know that it is not really medicine yet. Kaya nga nasa branch siya ng supplementals or nutraceuticals.
Oo, tama. Walang doses yun.
Oo,
eh.
walang
Di mo
dose.
alam. Exactly.
So, and alam mo, kahit sabihin mong hindi, Filipinos will really try anything to help them. Kasi syempre, lalo na kung helpless na situation, they will really propose something to you of something novel or something quite absurd. If it will work or not,
Right.
it will
Well,
work or
actually,
not.
there's
But
some.
of course, I give them my opinion about it. And honest opinion. Siyempre, unahan mo na opinion lang ito. Pero in the long run, kayo po. Pero yung medyo sigurado ko, huwag yung take.
I've heard that some people say that when you observe a person developing the symptoms of stroke, dapat daw painumin ng maraming tubig or
Ay, yan ang,
kulang
teka
sa
muna,
pagkain.
tulad yan ng any emergency, no? Don't do something that, of course, may harm the individual further, no? And if you're not sure about it, of course not. Why? Especially painumin, pakainin. Kasi hindi mo alam yung kanyang
Mas
power.
masama.
No, remember, what is evident when a patient comes in is just the weakness outside. But the weakness in swallowing and drinking may be affected as well at the same time. And sometimes,
Kaya pala nag-a-aspirate,
oo,
no?
kaya nga yun,
Nag-a-aspirate ka minsan.
pumupunta sa emergency room, nag-aspirate na siya, may karagdagang problema. So to do anything, as an emergency, well, of course, if he has a regular doctor, if somehow the BP is really astoundingly very high, then you may give something and there are emergency medications. But the first thing to do is really rush them to the
Rush to the
hospital. This
hospital.
is an emergency situation. I have to stress that. Kasi hanggang ngayon, meron pa anong ginawa niyo po? Ganon.
So, Doc, after the crisis is over, how long do you expect the patient to be hospitalized?
Oh, okay. Again, there is no rule of thumb there, no? Siyempre sa akin, minimistiso ko yan. Based on number one cause, financial, no? Kahit sabihin gusto mo namang bigay, pero nililay down ko sa kanila, ideally, alam mo, dapat bigay natin ng gamot, ganyan, number of days. However, syempre, hindi pwedeng darating yan, kukulitin ka talaga. Dok, medyo, kami, is limited ang finances namin.
Yeah.
Pero, pag stroke talaga, 3 to 5 days at least in the hospital, no?
3 to 5
At least
days.
para makita mo talagang nag-stabilize yung vital signs niya, ibig sabihin yung blood pressure, pulse rate, and everything. Somehow, alam mo kung ano deficit, alam mo kung ano maituturo mo sa pamilya, kung in terms of pagkain, kung ano mga exercises na pwede gawin. yung kung anong pwedeng activity, no, outside the ano. Kasi most of the time hindi alam ng pasyente, naghuhula lang ito. Ang isang common pala nilang tanungin is, Doc, pwede na ba akong mag-travel? Pwede na ba akong mag-aeroplano? Pwede na ba akong biyahe? Later on, gumaling, pwede ba magtrabaho? Ang kagandahan na kasi as in any specialized organization, meron na kaming lay down, parang pro forma niya, no? Ibig sabihin, like, just an example, yung flying by plane, 2 months after the
How
stroke.
about
no?
having sex?
Yan. Actually, gusto kong
That's
banggitin
common.
kasi naiyaw
How
kay
is that?
father. Anyway,
No problem.
no.
No
It's a
problem.
fact no matter what, no. Pero syempre, it's yung stress nga related to it, no. Wala pang lay down, I think, no. Pero syempre, obserbahan mo, no. I gave at least 1 month. Tagal ba yun?
Maiksi.
Maiksi.
So, 1
Hindi, tinitingnan ko.
You are candid about it to the patient and then,
Oh, yes.
Boleto,
Alam mo, in the
Especially
first
us.
place,
Especially
makikita ng
us.
pasyente yung sincerity mo. Kung
Correct,
ano
correct.
kaya, wala yung patigil-tigil ka na ay
Ah.
nako, ganyan. Hindi, sabihin mo, matapat ka. Ako
Right.
naman, father, hindi naman sa dyan kayo. Pero talagang naisip ko, paano ko matulungan ito? Kung ano, based on my experience, diretso kong sinasabi, no? And everything. Kasi pag you withhold or somehow you show signs that you're trying to withhold something, they will,
feel it
they'll feel it.
Mararamdaman din nila.
Oo.
and it's also your obligation, of course.
Oo.
Yung post-care,
Oh,
post-hospital
yes,
care.
of course. Once, sinasabi nila kaya maganda maging neurologist kasi once nagkasakit yung pasyente, talagang babalik sa iyo
You know, the most difficult subject in medicine talaga, neurology.
Katotohanan yan talaga.
Oo.
You discuss, kaya nga ako, medyo ako pinipik in a chart of the patient, no. Kine-check ko na yung topics about travel, kung na-discuss ko na ito.
Right.
Kasi hindi naman pa ulit-ulit yan. Yun nga, sex, going back to work.
Going back to work,
Can I
kailangan.
stress something in that? Kasi palagi tanong yan eh.
Sorry, we run out of time for our
Oh,
show.
God! Something very
So
important.
maybe
Importante yun.
we can start with Dr. Noble. Final words for our audience.
Okay. Well, anyway, as we discussed, stroke is a very important disease entity that affects us right now. And there is no way to stop it unless nakokontrol itong risk factors, which is still abound right now in our country and elsewhere in the world. That's why it still ranks as one top cause of morbidity and mortality.
Okay.
So, ang importante dyan is recognition, kung kayo nasa, and rushing to the hospital, and of course, post-care and everything. And hopefully, you will have a neurologist, and I believe, of course, na they will care for you. And don't hesitate to ask questions. Minsan kasi nahihiya, no? Whatever.
If they're
Yes,
paying
thank you so
you,
much,
they should
Dr.
ask
Noble.
questions.
What about you, Dr.
Oh yeah,
Sanchez?
you know, we forgot to mention that behavioral changes do occur in patients with strokes. And that's why the relatives and family members should be very patient. Because sometimes there's a change in character, correct?
Yes,
In the
definitely.
patient. So that's what we should do.
Father Jerry?
The relationship of the doctor and the patient must always be characterized by trust. No? When there is trust, communication will be very, very easy to do. One of the difficult things that probably we encounter is the giving of communication to the patient so that they will be able to understand, and even to the families. Okay, in which case the doctor must be good at the art of communication, since art is part and parcel of medicine.
Okay, thank you so much. Attorney Sara?
Well, thank you to everyone for watching. Teka, Doc, ano yung about work? You might as well give it as a last
Hindi, kasi
word.
palaging tinatanong yan, Dok, makakabalik ba ako sa trabaho? Of course. Alam mo, that's form of rehab. To find out, and they will find out themselves anong kaya nila o hindi. And
Now,
then they
should
will
the employer be told?
Oh yes, I always tell them no. Kasi yung iba, strict sila pag once nagka-stroke, ayaw na nila i-employ eh. Sabihin, it's a permanent deficit. Unless of course there are mental changes already in the patient. Pero ako, I insist, tinutulungan kong makabalik yung ano. Like,
Alright.
nakakatulong na may
And they
ginagawa
can
sila.
safely return.
We'll
right?
have to say goodbye now.
Thank you.
Well, lack of awareness of stroke risk factors coupled with the healthcare system that is largely private certainly leads to disadvantages for the population. The cost of post-stroke medication and management is borne out of pocket by patients and their families, and it's going to be a challenge, especially for our rural communities and the underprivileged sector. We pray that more will be done to stop stroke. Thank you for watching this episode of Medical Dilemma. Catch us again next Sunday at 6 p.m. here on GNN. Okay? You can also watch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis, be aware, and show you care. Have a productive week ahead of you.
Medical Dilemma